Doreen 𝗏𝗏𝗂𝗏 is the
Dr. Doreen is an expert in autism.
Doreen 𝗏𝗏𝗂𝗏.
Dr. 𝗏𝗏𝗂𝗏.
Dr. Doreen 𝗏𝗏𝗂𝗏.
Dr. Doreen 𝗏𝗏𝗂𝗏 is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen. Our topic today, as we start off this show, thank you for indulging all of that because I think it's important information. Our topic today is autism symptoms. You guys have written in a lot of different questions about what the symptoms are, what they aren't. And I'm going to give one of these and we'll see if we get to any more of them. Is there anything in particular that I should be looking for if I suspect my younger sister may be on the autism spectrum? She's currently 14. She was diagnosed with oppositional defiance disorder a few years ago when she was 11. When she was younger, she dealt with a delay in speech, and I remember she did not talk until completing speech therapy when she was about 3 years old. She pointed and grunted, but she didn't use words until about 3.5, 4. She is currently a freshman in high school in special education classes, even though the only diagnosis that she's ever received is ODD. She goes to a public school in Kentucky, so there are not a lot of resources around. Sending a hug to the sibling, first of all. What a great sibling.
What a great sibling to reach out. And it does break my heart. It makes me very sad to read that. I really dislike that diagnosis of oppositional defiant disorder because to me, when an individual has kind of oppositional or angry behavior, there's a function to it. There's a reason that they're oppositional. And I never, when you call someone oppositional defiant disorder, ODD, people tend to just be very punitive towards that individual and kind of think, oh, this person has anger issues, that kind of thing. And most of the time when someone is oppositional or angry, it's because they're frustrated, and we really have to figure out why. And it's really important to know that this individual had speech issues, and there is a likelihood, there's a possibility certainly that they are still frustrated and that they don't feel heard. I mean, any of us, Shannon, feel upset. Any one of us would be, upset and frustrated if we don't have anyone in the world that makes us feel heard, right? Like no one's listening to me. No one understands me. No one realizes what I need. No one understands the things that are bothering me in this world. And so that becomes a really important thing. Now, I can't say for sure because I don't know this individual. The symptoms of autism, and I'll just start with that, I guess. You basically have to have a minimum of 7 symptoms that are basically you have 2 areas, right? One area is the area of what we call social communication. The other area has to do with ritualistic or stereotypical behaviors. And in the area of social communication, it's like every symptom that is listed in the manual you kind of have to have. And these are things like, nonverbal communication. So lack of eye contact, inability to read facial expression. All of those types of things are communication. We take it for granted, but when I say something to Shannon and she nods, that is a form of communication, and it gives me the green light to keep going, right? And that is, it's little subtle things like that a lot of folks on the spectrum don't know how to interpret. Right. Facial expression is a very important one. And then there's all of verbal communication, obviously. If I pronounce something in a certain way or my intonation is in a different way, it could mean a completely different thing. Those types of things in communication also are very subtle but very important. And communication, of course, leads to social behavior. So being able to establish friendships, have appropriate social life or social behavior with peers, all of those types of things are also vital to establishing relationships with others. And when you're not able to have those verbal or nonverbal skills, it becomes really difficult to interact in any way. So those are some of the symptoms of the social communication domain. And then the other domain is the stereotypical repetitive types of behaviors, which vary really. Some of our kids have behaviors that are very rote. For instance, they might line up their toys. They might have like finger flicking or body rocking or staring at objects that go in circles or staring at lights or all of those types of things. But then there are also more subtle ones like I must have a certain routine every day, right? So kind of obsessive types of patterns of behaviors. And when there are two in the stereotypical area and all of the symptoms of social communication, then you receive that diagnosis of autism. It changes based on the severity. What you see changes based on severity. It changes based on age. So if you have a very severe individual, they might not be able to communicate at all. And if you're not able to communicate at all, you will have some challenging behaviors like aggression because you're very frustrated. You might have a very, very obsessive need for things to be in a particular order. And if anyone messes up that order, you will have challenging behaviors because your whole world is in chaos. So it's hard to say if an individual is experiencing, or has symptoms of autism and therefore is experiencing ODD type things or oppositional types of behaviors. Could be something else as well. It could be that they have pain that they're not able to express themselves. It's possible that they just have a language delay that results in not being able to express themselves. Clearly, when you have oppositional behavior, there's a mismatch in being able to communicate and express yourself. And so, it would be important for that, for our viewer to help the individual get a different diagnosis, maybe go see someone now at this age, and hopefully they can help identify what's wrong.
Yeah, whenever people talk about ODD, you know what I think about, and it's wildly inappropriate, but the women will understand. The men are still going to be scratching their head. But I had a boyfriend in college that if I would get upset with him about something that he did, his response to me would be like, "Are you on your period?"
Yeah, yeah.
And I would go, okay, while it is true that I get a period and that some things set me off even more when I have my period, it's not like having my period makes me get set off for nothing at all.
Yeah.
And I have a right to be upset about when you do something. And it was a diversion, right? And I didn't end up with him, thank God, right? Right? But it's this thing about, I think when people say somebody has ODD, it's like, oh, well, they're going to just...
They're just going to be angry.
They're just going to be angry and they're going to be opposed to things even that they want. So, okay, we're done here.
Nobody wants to figure out what's wrong.
Right.
Right.
And I think in my life there have been times when I have been so mad that if you had offered me something that I wanted, I still wouldn't have taken it because I was mad about something that was real.
Yes.
Right? And so for me, a 14-year-old who is that angry, because I have heard you say that those feelings, they don't just go someplace into a vacuum and that sometimes they turn inward.
Exactly.
And
that's
the concern. Suppression, right? And I woke up this morning to hearing that, somebody that our family knew, a 24-year-old, has died from their addiction. Oh. And it's just like, like what, and you go, oh, what can we as a society do? But then, when you think about a 14-year-old who's clearly in pain. Yeah. That I love that this sibling is like, maybe I need a diagnosis in order to get help. Right. But I guess what I want to say is let's get help regardless. Yeah, and sometimes, I agree with you, but sometimes it's just hard to get help without the diagnosis. And especially in Kentucky, Like, look at this situation. Like, years ago, someone has said this individual has oppositional defiant behavior, and it's just stuck with them, right, for years, and they're in a special ed program. And, maybe it's just that the education system was too difficult for them, or something was too difficult for them, so they had defiance towards it. Or maybe it was too easy. Or maybe it was too easy. See that on really good point. Yeah. That they're bored and they got nothing to do. Yeah. And so they create some sort of drama because at least that's interesting.
Right, right. It's very, so I think the steps to take, and it's amazing of this sibling to care so much, but the steps to take are to, contact insurance, because you probably have some form of insurance that gives you the ability to get a diagnosis or get an evaluation. Because I'm guessing the school's not going to really get involved and do anything. They've placed your sibling and they're not going to do more. So I think at this point you need to find a developmental psychologist or psychiatrist who can do an evaluation and give you some ideas.
And I also have to say too that it feels like the system is letting this young person down.
Absolutely.
But it's not to be without hope, because sometimes it just takes one even teacher.
Yes.
Who recognizes and goes, I see something in you.
Yeah.
Oprah talks all the time about the teacher who said, you have something in you, that you are a great leader. And that no one else saw that, but that teacher did, and that sometimes, you never know what's around the corner, but don't give up, don't give up.
Don't give up.
All right, we're saying hello to a lot of people. Alicia Hendricks is with us. Hello, Alicia. Wonderful. And we see that we have Paula Winton. We've got Amanda Bright, we've got Joanne, we've got Parker, we've got Dark Angel. Taryn is with us. I'm saying hello. I'm told that Traven Hardy's mom is with us. So we love that.
I've actually written an article about that. It's because girls are less obvious in their symptoms.
Yeah. Alicia has identified herself as being the parent of the 14-year-old. She says, I can't get doctors to understand her situation. Everyone wants to medicate her. The school only provided her a safe place to go when she gets upset, and I had to fight for that, but good on you for getting it, Alicia.
Yeah.
That's amazing. She says that she is happy to be here, but it is hard when you can't get people to listen to you. I would venture, Alicia, that probably everybody on this chat can tell you horror stories about the fact that they went to 1, 2, 5, 17 doctors and people weren't listening. And it's terrifying. It's terrifying, and it feels like where is the help going to come from? But I can only hope, if you keep trying, that someone's going to show up.
And Alicia, is she able to express herself when she's getting upset about something? Is she able to express herself before she gets too upset? And is she able to request something, like you got her a safe place to go, that's great, but by requesting to go to a safe place, she's always removing herself from whatever is going on in the classroom. Is there any way that she can gain peace and serenity without leaving the classroom? For example, could she have, I don't know, a short break where she puts on headphones and listens to something calming? Is there some aspect of what's going on in the classroom that causes her to become upset, that she can that maybe we can modify the classroom or the program so that thing doesn't occur in that way? Like, it would ideally, we try to accommodate kids before a problem occurs, not after. So we don't want to always just take her out when she's getting upset. We want her to be able to express to us what it is so that they can accommodate by changing the classroom or changing her program.
Yeah. Alicia says, to answer to your question about the 14-year-old, that they won't allow it. And she says that the thing always comes after.
Yeah, that's the problem. I mean, that's sometimes, if people don't figure out what is causing an issue for a child and they just remove the child from the circumstance after the child has a tantrum or something, then what they're doing is they're teaching the child that the way to communicate to us that you need something is by having a tantrum.
Yeah. I kind of want to go to your IEP.
Yeah.
because here's the thing: if you have the IEP in place and you put and you already fought for the room that she can go to calm down, there's other things you can fight for.
It's true.
And ways that they process it. And then once it's in, if they have a behavior intervention plan and on your IEP it's checked, the behavior intervention plan is checked on that. Now it becomes part of the legal document and they have to follow it. And you can fight for them to have to take steps to do things.
That's right.
It's a fight. It's a slog. It's your
is.
time.
It
It's your
is.
energy. But, she's worth it.
Yeah, absolutely. And it's just a matter of really observing the times when this happens. And usually when you observe, you'll be able to figure out, oh, this is what takes her off. This is what caused her to go into that behavior. And how could we, and sign, those little signs are then you take those and you teach it to the teachers so that whenever they see those signs, they actually will prompt her to say, I need a break. Something like that would go a long way for her. It would be really helpful.
And it's cutting off some of the responses here. And so, Andrea, I don't know when you said you would have to watch the show, I don't know what you're referring to because it's cutting off some of your answers and I don't know why it's doing that. But unfortunately, we are out of time. You can write to me. Any of you can write to me and I will forward things to Dr. 𝗲𝗓𝗃 if you want her to know something. My email is shannon@autism-live.com. So shannon@autism-live.com. We really appreciate all the things that you guys are doing in your lives for all the people that you love. Let us just acknowledge that that's a lot.
Honestly,
and that
it really is.
You are enough. And I know sometimes it doesn't always feel like it, but I certainly have seen, and you have so much more experience than I do, but when parents care as much as you guys do, it's always, a better outcome for those kids and those teenagers and those adults.
Absolutely.
Always.
Absolutely. I always say that with autism, it's always the parents that move things forward.
Yeah.
No question.
So you guys are doing an amazing job and you're asking all the... Oh, Andrea says, sorry, that was my fault. I was telling my husband to watch the show and instead of sending the text, I wrote it on here.
I love that.
I love that. Andrea, thank you for answering the mystery that I was going to worry about all day long. And I find that hilarious. And I love your crying, laughing faces here. I've learned how to text by talking.
Yeah.
And I've sent the wrong text to 3 people this week. And they're like, what? Like, no, disregard.
And I want to, before we end the show, if Traven's mom is still on, I just want to say we love your son. He does so much for us, and this show is really dependent on him, and he's an excellent producer for us.
Amen to that. You've raised a fine man.
That's right.
And we appreciate. I would be lost in the weeds without.
Oh
Traven.
my gosh.
Lost in the weeds. So thank you for gifting us his time. Don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time. We hope to see you there.